Burgers and fries, chicken wings and pizza on the streets of South Los Angeles. It's easy to fill up on cheap fast food.
Every intersection where there are 4 corners, 3 of those corners are usually filled with fast food restaurants.
But for fresh produce or a restaurant that serves salad, you generally need to travel to another part of town. Nearly half of all the restaurants in South LA are fast food chains, by far the highest concentration in the city.
We're not saying that we want everybody to eat bean sprouts and tofu. We just want to have the option that when they want to choose healthy, that it's there, and they don't have to leave their communities to do that.
One big and tasty meal?
Residents and community leaders blame fatty foods in part for an epidemic of obesity-related diseases, such as high blood pressure and diabetes.
I can look at people I know, and some of them have already had amputations, from diabetes, or to see kids we know who are less than, say, 13, 12 years old, and they're already morbidly obese.
And they say the problem isn't limited to Los Angeles.
You could take a camera in any low-income community of color across the nation and find the same things, and it's no wonder that the same results are being produced city by city by city throughout the United States.
There are a lot of folk watching across the country right now who really don't understand the fact that a lot of people of color in America end up not being healthy, born primarily of the fact that they ain't got no healthy food options where they live. Absolutely. They can't imagine that we don't have choice meat and fresh vegetables and fresh fruit, that we have to drive 20, 30 minutes to get to that. This is your conversation, not mine, but I want you to understand that we're in the same neighborhood. So I understand this, but talk to those persons watching who don't understand that this is a real serious problem.
This is a serious problem. I think people do take for granted the fact that in many communities, at the end of the day, if you're tired and you have children in tow, that you can go down the street and find a decent meal for your family. In a community like South LA, at the end of the day, my choices are McDonald's, Fat Burger, Burger King, and if I'm lucky, I can come over to El Pollo next door to your offices. Yeah. But you'd have to drive 20+ minutes into other areas in order to find a healthy meal. And we're eating out more, and there are serious implications about that, not only in terms of not having access, but then what's going into our bodies, the kind of food, the high level of grease and fat and the preservatives. We don't have access to the kinds of things that keep our bodies healthy. And of course, this nation is becoming increasingly preoccupied with this concept of obesity and assuming that if people have a choice, it's people's personal responsibility to lose weight and to be healthy, when in fact, those resources to support a healthy lifestyle are absent in so many of our communities.
You've got to have choices to make choices, and then in addition to that, you have to have the ability to make those choices easy and doable. And what the wake-up call for America has been is our healthcare costs are going up, our productivity is going down, we have huge health issues, and we've got to rethink how we support people, and we have to think about how we define success.
You've seen in areas like Rochester between 1970 and 1995, 42 supermarkets. By 1995, 8 left in the city. Same thing happening here in South LA. But folks buy. We spend money, and we spend big money. Study out of Pepperdine showed that folks within South LA spend some over $400 million outside of their community trying to find healthy food, so that they know the purchasing power is there. The question is, do you want to be in a black and brown community?
If they put one Jamba Juice in South Los Angeles, you can't go there without having to stand in line. That's how packed the place is, because again, people yearn for these opportunities to consume things that are a little bit healthier for them.
Our dollars are as powerful as any other person's dollars. We deserve better care. We deserve better food. So I think consumers can make a big difference. But we've got to get organized. We've got to put that pressure on corporations. We also have to put pressure on our elected officials, because there's a lot that can be done. We're running a project here in Los Angeles, part of the Center for Disease Control. It's funded programs throughout the nation, about 40 of us in total, that are looking at the fact that communities are dying disproportionately of heart disease, diabetes, and these are low-income black and brown communities. And what can we do? We can change the context of our communities.